Facebook.
Let's see, Facebook.
Okay, sorry, it's asking for my. Oh, I think I'm not. Uh, we're not. Uh, um, if you are you.
Mm-hmm. Mm. Let us see. Mm-hmm.
You cannot.
Yeah, for now, doctor, it looks like
It's okay.
I am unable to do that, doctor.
You
Hello,
are able
everyone. Thank you for joining. I
to.
think we do have attendees on Zoom currently. We are just trying to do some technical stuff to make it live on Facebook as well. Mm-hmm. Mm-hmm.
Yeah, shall we start?
Hello, doctor. Are we able to do the live? Not yet.
No, I cannot.
Mm-hmm.
Okay,
All right, sure.
I think
So
we can start.
we can start, all right? So looks like we do have quite a number of attendees today, and thank you very much, everybody, for joining. Uh, for today, the purpose of this webinar, of course, is to educate everyone, especially for those who are proactively seeking treatments for spinal cord injuries. Could be, friends, family members, or patient themselves. And these insights or information will be coming through the expert and the patient experience, of course. Let us start by introducing, of course, the stars of this webinar. We have here Julia. Hello. She's one of our
Hi.
amazing patients, and you might have seen her in our post. Julia, why don't you introduce yourself and maybe tell us a bit about your condition?
Yes. Now, my name is Julia. I'm from the Netherlands, and I'm just got 8 months ago. I got injured through an accident, a car accident, and now my condition, it's I'm paralyzed from halfway the chest down, a spinal cord injury complete, and that's why I came to Verita to recover.
Mm-hmm. Thank you, Julia. And also joining us is our Verita Neuro medical director. His name is Dr. Nasir. Hello, doctor. Why don't you tell
Hi,
us a
Via.
bit more what you do at Verita Neuro?
Thank you, Via. I'm Dr. Nasir. I'm part of the medical team. Actually, I'm responsible for development and also putting she's one of our patients who recently concluded her treatment actually last week. As she described her condition, she's suffering from spinal cord injury at T7, T8 level, and she's paralyzed from the level of injury below with the complete loss of motor and sensory functions.
Thank you, doctor, for that brief information. And I myself is one of the patient representative who are, usually the first contact of all the patients. And we facilitate the medical evaluation and of course help. In this case, I helped Julia with the practical arrangement before traveling to Thailand for treatment. And so, Julia, could you tell us a bit more? How did you find out about Verita Neuro and, of course, epidural stimulation treatment?
Sorry, one time again. The question.
How did you find out about Verita Neuro and epidural stimulation treatment?
I found out because the information from my dad. He is also, he has a company in medical equipment, and so he is traveling around the world and come to visit in hospitals, and he just hear about Verita from like a nurse or a doctor. And then he checked it on Facebook, and then he sent just you an email about the information, and we got a lot of information and good information that we decided to come to Verita.
Right. I remember dearly that your father was very thorough and made a lot of effort in providing all the information.
Yeah.
Your injury is around 9 months old. Around that time, and 8 months. Yeah. What were your expectations prior to arriving at Verita Neuro or to Thailand?
Yeah, my expectations. The number one expectation was that I have a lot of nerve pain. I had a lot of nerve pain, and it was just it had a big impact on my daily life because I had that much nerve pain. So that was number one of the expectations, that I hope that with the treatment from the stem cells and the treatment from the input of the neurostimulator, that it will be better. And I also had an expectation that with the training and the mapping that I become a lot more stronger. In my arms, in my legs. So that was two of the most important expectations that I had.
That you are hoping to improve.
Yeah,
right?
yes, of course.
And before the treatment, I believe you have done a lot of things. However, could you maybe tell us what are the treatments that you did, or maybe the things that you did before coming for the treatment?
Yeah, when I got the accident, I went for 3 months inside a clinic to recover from my spinal rehabilitations. Just not recover because I have the spinal cord, but to become self independent, like that I can do everything by myself.
Yes.
So I did that for 3 months, and after 3 months, like here in the Netherlands, is it finished? So I was not able to do more recovery. So then it stopped, but I was not just satisfied with that result. So that's why I was looking for something else that made me stronger and made me just in the hope to come a little bit better.
From my understanding is that you are doing a lot of training, exercises, and these things, which we think is very good for you and of course for your recovery. And doctor, how important it is, in line with Julia's, date of injury, and as you know, it's relatively kind of fresh. Can you explain, the advantage of getting any other treatments, and especially epidural stimulation? Of course, physical therapy, the importance of this to do as early as possible.
Yeah, obviously, there is a window period for better recovery, of course, but sometimes sooner. There are a lot of changes in the spinal cord. Our spinal cord goes through what is called astrogliotic scar tissue. It's basically chronic scarring of the spinal cord at the level of injury. And this is, of course, a natural mechanism by our body to try to seal off the injury area and try to prevent it from getting infected. But it also prevents the recovery. So if we can interact or we can interfere with this scar tissue process early on, we can actually prolong the window period for recovery. So stem cell treatment plays a very important role in the early phase. So it's basically prevents the body from going like thick the level of injury. And when the spinal cord stimulation is implanted during this phase, combined with stem cell treatment, and patients go through a lot of physiotherapy, rehabilitation, we are able to get better recovery. So it's very important. And for any patient with the spinal cord injury, I think, of course, the most important thing they can always do is just extensive physiotherapy, no matter there is an evolutional motor function or not. Even if this is like very, very passive physiotherapy, it is still beneficial. It can prevent a lot of complications in the future. It can preserve the muscle mass, the bone mass. It can prevent the spinal cord from getting like more scarred, even atrophied. It can actually prevent the spinal cord atrophy in some patients. So the physiotherapy is, I think, the single most factor which is in patients their own hand or their optimal recovery. So this is what whether or not we therapy. Okay.
Let me just have a look. So, before we proceed, I would encourage everybody who is joining us to maybe write any questions. So, of course, we can answer it afterwards. And going back to the medical evaluation, Julia, how was it? Was it difficult? You mentioned that they reached out to us. How long did it take? Was all the information sufficient before you decide to go for the treatment after the evaluation and the consultation, or did you do some other self-research or stuff like that?
Yeah, I just before I made the decide to come, I spoke to some patients to just to ask my questions like what can I expect and what
Yes.
is what of results do you have, and that's that I spoke to some patients that make the decide to come to Verita, because every patient was very positive, and yeah, I couldn't wait to come and to make my own progress and see the results of my operation as stem cells.
Right. So yeah, I think it's very important to hear insights directly from different patients, kind of give a little bit of sense of confidence in doing what they feel they will be helpful for them. Doctor, in line with the medical evaluation, we have been receiving a lot of inquiries actually, and they just give us base information. Hey, can you treat us? Things like this. But how it is important that we get the right information, by looking at the MRI, to know if they really can do the treatment. So say, for example, for Julia, why did we decide that Julia qualified for the treatment?
Right. Yeah. The spinal MRI scan is by far the single most important method for us to evaluate a patient's candidacy for the spinal cord stimulation. There are, of course, I think the structure of the spinal cord tissue, the level of injury, the integrity of the spinal cord above and below the level of injury, the integrity of the vasculature, whether there was maybe a blood vessel rupture, whether there is enough blood supply to the spinal cord, where there is spinal cord atrophy. So there are a lot of useful insights we can get from a spinal MRI scan. So that's I think the number one most important factor. Apart from this, of course, there is a lot of subjective information we need from the patients. We try to make it as easier as possible, but of course, still we would need some basic information about patient's condition and the subjective symptoms they are suffering from. And of course, we take some time going through all the information very carefully to determine whether someone is a candidate for the treatment. Of course, not everyone is a candidate. There are many patients, unfortunately, who do not qualify for this kind of treatment. So in Julia's case, likewise, of course, we looked at the MRI scan and we concluded that she was a candidate for the epidural stimulation treatment, which of course was conveyed to Julia. And after we confirm someone is a candidate, of course, we go through a one-on-one consultation with every patient to explain about the treatment, what to expect, what are the limitations, what are the side effects or complications. And after these patients are free to decide whether they would like to go ahead with the treatment.
Mm-hmm. All right. So moving forward, Julia, from Netherlands to Thailand, how did you feel when you first arrived at Verita Neuro facility? And what are your impressions? Mm-hmm.
Yeah, when I just arrived at Verita Neuro, there was someone at the airport to pick you up, and then we got to the hospital where I just, it's a very good hospital where Verita is based in, and the people are very kind, and it's all very new. So, I have a good first impression. I was just a little bit nervous, but when I came there, just every nerve of me get off, and it was good to be there.
Right, and I'm happy, I'm happy for the trust that you've given, and we are the leap of faith that you that you did it to finally come and start for the treatment. And how soon after the surgery did you start to see changes?
Right after the surgery, I could lift my legs, both legs. How do I say it? I could lift my legs up right after the surgery. And
After the surgery.
And also 3 days after I started mapping, and then I just also get results directly. So I could kick my legs and I could move my legs.
Oh, okay. So it's almost, kind of like immediate response. Dr. Nasir, are these changes similar to any other patients, or are there any other immediate changes that we can see within the 35 days of treatment?
Right. Yes, I think these changes are somewhat expected. Of course, during the surgery, one of the most important things we do is intraoperative testing. We spend quite a bit of time with the help of sports staff from Medtronic to go through mapping, little bit of mapping and muscle contractions. And we basically optimize the location of the electrodes based on where we see the optimal muscle contraction. So of course, during the surgery, we can somewhat confirm that yes, the epidural stimulation is working for this particular patient, right? So once we start mapping after a few days, like proper mapping with the proper protocol, yes, we do expect to have muscle contraction. And for us, of course, it's something we expect. And but from patient point of view, yes, I think it's very exciting.
Right. I think it is also, also very important to understand that we may see even more changes even after the treatment, right? Given that, of course, you continue on with the therapies and rehabilitation. Julia, can you tell us a bit more, how does your regular day looks like here? I have mentioned it's 35 days, but maybe you can share with our viewers what have you been what did you do during that period?
Yeah, when I start the day, yeah, after my breakfast and my preparing and everything, you go to the rehabilitation center, and there are the people from Verita, and then I start with 2 hours of mapping with a mapping specialist, and then they train. Yeah, in my case, we trained just first to yeah, practice standing and walking with the stimulator, and I after lunch I get 1 hour of stretching and exercises for my balance to improve my balance. And after that, I just finish with 2 hours of mapping. So it's like 5 hours of training each day. Yeah, to practice and to become better and stronger.
Yes, very good. So it's kind of like I've always mentioned to patients, it's going to be hard work,
Yeah,
and
it
I,
is.
you know, I believe it's also like you are very committed to doing that even before coming, and I trust, of course, after 35 days that will basically 3 to 5 hours of training Mondays to Saturdays is quite extensive. So I'm happy you survived that.
Yeah.
And yes, and you have mentioned about your mapper or your mapping specialist. I kind of had a quick chat with her, and she kind of mentioned that one of the greatest achievement is that you could stand with your Canadian crutch by yourself for 1 minute, which is, the biggest move for the first time of the treatment. How did you achieve this? How do you think you're able to achieve this with my?
What the question again?
Mhm. The greatest achievement is, you could stand by yourself using a
Mhm.
crutch
Yeah.
for 1 minute. And
Yeah.
what does help? What do you think helped that you achieved this milestone?
I think that you have to trust in yourself that you can do it, and just yeah, I had to be strong, and you have to have a little bit patience because you first have to exercise a lot, and yeah, just have trust in yourself that you can do it, and I had belief in myself that I will move forward, and I just got trust in my mapping specialist, and then yeah, I reached to stand for 1 minute, and it was very good. I can tell.
Yes, we saw actually a lot of your videos showing that this is something you're able to do. And Dr. Nasir, I have learned as well that the most challenging part is that her muscle tone and spasticity has changed in 1 month. Because I think she has stopped as well some medicines, and in the same way, it also counts as success because Julia didn't need to take the medicine. Um, what are the challenges when it comes to spasticity with this kind of treatment?
Yeah, I think spasticity is one of the factors which can just make it difficult for us to map, because if there are a lot of spastic pathways, patients have a lot of spasticity. So spasticity in a way is actually a good thing. So of course, from our understanding how spinal cord regenerates after a severe trauma to the spinal cord, usually there are no functionality initially, but over time, some pathways which were spared during the injury, they become functional again. So of course, um, they are not proper, right? Because there are different mechanisms to regulate the muscle tone. Some of the mechanisms are not working. So the pathways which are left, they are basically kind of like unleashed. So they try to do all sort of things, right? So they usually become super excited because they are the only ones, and they have to compensate for the loss of other fibers. So they become spastic pathways, and But it's a good thing in a way that it indicates that there is a little bit of connectivity coming through the level of injury, but it is challenging at the same time. I think, but the good thing is over a period of like 9 years now, we have learned a lot about those spastic pathways, and we are able to manage those spastic pathways. I think it's not a challenge. Initially is a challenge, but it's not a challenge anymore. We can use the stimulation, or we can basically reduce the patient's medications, or maybe increase the medication. So we can try different things to try to regulate those spastic pathways, and we can basically use them to our advantage. So sometimes it helps actually for if patients are spastic. But if it is too much spasticity, sometimes is a trouble. In Julia's case, initially she had a lot of spasticity for first few weeks, but I think she was she had lower muscle tone, and because she was on a higher dose of antispasmodic medications, so we were able to stop the medication, and we were able to have a very balanced muscle tone eventually.
Right. Thank you for sharing that, because I think spasticity, of course, is very common for these cases. Yeah.
Right.
Julia, to all the viewers, of course, it's not just epidural stimulation that Julia had. She also got the stem cell treatment. Julia, how was the stem cell treatment for you?
It was also very positive. I get it one time through IV, and 2 times I get it injected in my spinal cord directly. And it was done in the hospital with a very good doctor and very nice nurses, and I didn't felt anything. It was not hurting at all, because they placed it under my feeling, so where I don't feel anything from the spinal cord they injected. After I didn't get sick, didn't get ill, so it was just a good experience, the stem cells.
Doctor, with regards to stem cells, what stem cell did you recommend to Julia, and why this specific kind in combination with epidural stimulation?
Yes, so we have different types of stem cells based on patient's individual condition. In Julia's case, we went for mesenchymal stem cells. So mesenchymal stem cells are basically a type of adult stem cells. One of their main properties are their anti-inflammatory and anti-gliotic properties. So, like I mentioned earlier, stem cells they are able to reduce the scar tissue. And mesenchymal stem cells, particularly, play a very important role in naturally reducing the inflammatory response of our immune system against the injury. So, since Julia was in an earlier phase of her injury, we thought mesenchymal stem cells would be a more specific, more beneficial type. So this is what she received. She received, of course, a higher dose of stem cells. It's 200 million stem cells in a single treatment, where around 30% stem cells were injected by intravenous injection and 70% by 2 intrathecal lumbar injections into the spinal fluid. So we think this combination works better, because each delivery method had its own advantage.
Right. And going back, going forward to the treatment that you are doing. So you did epidural stimulation and stem cells, and you also do a lot of mapping, Julia, right, with your therapist. How do you describe mapping for mapping by your own words, and how is the process?
When we just start mapping, they just look how the muscle is responding. They try a lot of different programs, and they look for just the right stimulating for your muscle to make it work. And then they try different programs, and they just looking through the days and weeks which program is the best for each specific muscle and how the muscle is reacting, and on the just with exercising we come to just a type of different programs, like a program for kicking, program for lift my legs up, and a program for standing and also for walking.
Right. Doctor, I think Julia have described it very good in, kind of like layman's. If you could explain, in medical perspective, how it is and how it is important is as how it is important for the recovery, and maybe it's also important to touch how maybe it is also important to tweak a little bit more in the future.
Yes. So for patients who are paraplegic, the stimulator goes to a specific part of the spinal cord, which is called lumbar enlargement. It's like a visibly thicker part of the spinal cord, like quite thick, spinal cord at the lumbar level. So there are a lot of populations of what are called lower motor neurons, like specific populations which are responsible for directly causing the muscle contractions, right? So those populations are residing in the lumbar spinal cord. So basically, during the mapping process, we try to use a very specific combinations of electrical stimulations, electrical currents, frequency pulse width, combination of different electrodes. Is quite sophisticated process to try to stimulate very, very specific, there are very small, tiny parts of the spinal cord. So we try to stimulate those specific segments for each specific function. And once we get those specific, like individual muscle contractions, muscle functions back, we kind of have what is called walking program or standing program, where we combine all the smaller programs into a bigger program and try to basically give stimulation to all of the muscle groups required for patients to stand and walk. So we basically, we find individual muscle contractions and then combine them together, which is ultimately used for patients to train their standing and walking performance.
Right. Thank you, Doctor, for a very helpful explanation with regards to the mapping process. Julia, could you name 3 things that changed most significantly after the epidural stimulation surgery?
I have just to look because I just write it down, and I just forgot what I wanted to say. I can't find it. Yeah, it just the most 3 things is that now I remember. I don't have like the 3 most important things is that I don't have any that I don't feel nerve pain because of the stimulation. Yeah, it works also on my nerves, and I have less nerve pain, like almost nothing anymore. And I just also became much stronger. Also in my arms as in my legs, I just gained more muscles in my legs. And the last thing that is improved is that I'm very happy that I be able to stand and walk again. It's just the feeling that after the accident you always sitting down and you can't stand or walk. And for me, it's very important that I can do it again. Just also for my blood circulation and everything, and it's also good for my confidence to, I feel like another woman again to be able to stand. And that is the most important thing, I think.
Right. My impression, at least so far with our conversation, you have quite some realistic, expectation. And we are very happy to work with patients like that. So for now, of course, our most, greatest achievement, which I think is very happy about, is, standing. Hopefully, very, very soon, you started doing already, started walking with assistance. Yeah. So yeah, very good. We'll be watching, of course, more of your progress. And what else? Another question is, uh, what did you like most during your stay? Well, here in Thailand, because technically you're back in Netherlands. But what did you like most about your stay in the
Yeah,
hospital?
like personal, it was the intensity of training, because
Mm-hmm.
I was used before the accident. I was training like 5 times a week.
Mm-hmm.
I was very sportive, and yeah, I liked the most that I had that I have the I was able to train that much, like the mapping, and to yeah working on my body. So I think that was the most important thing that I liked about my stay, that I was be able to train a lot.
Mm-hmm. So it might be related to my next question, that to ask, how is the medical care different from healthcare back home?
Yeah, it's like I told before, that it's just only 3 months of recovery here back in the Netherlands, and then you have to find your own way to recover,
Mm,
to make your progress, and then that you have still the recovery. But you have to do it on your own. You don't get
mm,
someone who is helping you. So I think in at Verita Neuro, it's that you have more possibilities, and you now also, when now I went back home, but you we keep in touch also when I'm
mm,
home. That when I have questions or anything, that I'm able to come back uh,
mm,
to do more training. And I think that is
mm.
the most important difference between back home and there.
Mm-hmm. Right. It's kind of, what you said reminds me of the previous webinar we had with our patient from Mexico. He also kind of mentioned somehow that he they were only being trained how to get used to a wheelchair, and
Yeah,
he's kind of happy to see other possibilities that you can still do more. So
yeah,
I'm just very happy to see and to hear it from you as well. Well, you mentioned about staying connected with us even after 35 days.
yeah,
That is correct, of course. As long as you want us to stay in touch with you, we'll be very happy to be here for you. After the 35 days of treatment, we will do kind of like regular follow-ups with Dr. Nasir still, um, maybe after 6 weeks or maybe after 6 months. And from there, we can plan ahead, what is the best way moving forward as well. So we can still guide you even remotely about what to do. What else? So let's talk about your long-term goals. What are your long-term goals?
my long-term goals. I I'm planning now to come back in 6 months. 6 months to have more stem cells and to do the remapping, because my goal is just to stand better and to walk better. And I hope that with a lot of training also at home, but also at Verita in the future, that I will become better in balance to stay able to stand on my own, and to be able to I can't walk. I can walk now with a walker, but just 10 meters and not that quick. And I hope that when I do a lot of training, that it will become better and
Mm-hmm.
faster.
Yeah, I would like to
Right.
add. Yeah, I think in Julia's case,
Sure,
of
doc.
course,
Mm-hmm.
it's. I think it's just slightly over 1 month since her injury,
Mm-hmm.
and actually 35 days since the surgery is 35 days. And I think she's making she actually already made a great progress, but of course we think this is only really a beginning. Of course, the muscle control is not sufficient for her to walk like for longer distances, right? Like she mentioned, she's able to stand, which I think is a great achievement already, right? It doesn't happen in every patient at this point, so I'm very glad Julia is able to have like muscle contractions, because for the knee locking, there are like some bigger muscle groups which have to come together to lock the knee, because there is a lot of weight onto those muscles. But I'm very happy Julia is able to do knee locking and able to stand. I think this is first milestone. The second one would be to be able to walk longer distances, right? Which I have no doubt. I think her condition, there are many good factors um, which can contribute towards her recovery, her age, of course, her commitment, and the duration of injury, the level of injury. There are many factors. So I'm very hopeful. Actually, I'm expecting myself for Julia to be able to walk quite a long distance with minimal support in the future. Of course, it's a long way to go, and I'm glad Julia is committed and she understands that it's just a start. I think we got a question from Mr. or Mrs. I'm sure, sorry, Ibi Ronke. That I think they are asking, would age be a prognostic factor in this case and other similar cases? I think age does matter to some extent. I think the most important factor is if patients are, some of the patients we treated, they're quite on the older side, more than 55 or 60 years old, but they had been very athletic before the injury. So they had a good cardiovascular function, they had good body weight, they had good cardiopulmonary respiratory function, and of course, a lot of commitment. In those patients, it did not matter that much. We were able to see very good recovery. So I think age is a factor in this sense. If someone is able to, of course, go through the extensive training like someone who is 20 years old, then I think at the end of the day, it should not matter. There should not be any significant statistical difference between a 20 years old or maybe 50 or 55 years old patient, as long as both are able to do the same level of intensive training.
Right. Dr. Julia mentioned, that she is planning to go for in the next 6 months for treatment. How does the protocol look like when patient return? Because many patients are asking, will it be 35 days again, or maybe can they go to Canada, to Mexico, or other facilities?
Yes. So the main treatment is which involves the surgery and initial stem cell treatment and mapping. During after 6 months to 12 months, many patients, the spinal cord basically regenerates. It goes through some kind of changes, which would require some fine tuning, some adjustments of electrical stimulations. So this is called remapping or reprogramming. For those patients, we usually need 1 to 2 weeks to optimize the settings, just for like mapping. And during the same time, many patients, they receive a second or third dose of stem cell treatment. So this can be performed in Thailand or Mexico. In Canada, only mapping can be performed. Stem cell treatment cannot be performed there.
Right. Thank you, Dr. Nasir. To the attendees, feel free to ask, all right? If you have any questions, we still have 15 minutes. And Julia, what would you say about the Verita Neuro team?
I only have positive words for the Verita team. When I came there, you can feel, or how do I explain? I feel that they are just they are good, very good trained, and yeah, they are high graduated. I lost the words. That's yeah, they look high graduated and they have a lot of experience. And I feel that they had it. And yeah, and also the people are very kind, and they yeah, will help you to recover. Yeah, they want to help you to recover as much as you can.
So what another question is, was epidural stimulation worth it, and why?
Yes, it was worth it all, because I don't want to lose a lot of muscle contraction, and with the stimulation I am able to keep training my muscles, and I think that is one of the most important things of the stimulation, that yeah, I can keep training my muscles and that it's not going to be less.
Let's see. We All right, I think we have covered much questions. I do have one more. What's one thing or advice would Julia say to anyone considering the treatment?
Yeah, what my advice is for somebody who is who is thinking to go, or is that the right question when I translate? Yeah.
If someone is considering,
yeah, I have just one thing to say, and my thing is like, go, because it was an amazing experience, and I hope that everybody with a spinal cord injury, that they are able to come to Verita, because yeah, you will be better.
Yeah, I think I would like to add, unfortunately, as we understand, the more we learn about spinal cord injury, the more we know it's very, very difficult. Actually, it becomes more difficult to treat. The more we learn, it's really complicated condition to treat, right? So in the absence of like more conventional options or drugs available, I think epidural stimulation is perhaps the best treatment option available to any spinal cord injury at the moment. Most of our patients, they agree, and there are many ways it can help many patients. So yes, I agree with Julia, right? If someone is considering, I think it's probably the best option available to them at the moment.
Right. I think that's it. So we do have 10 minutes. I don't see any questions from the attendees. However, if we still have time, maybe someone can drop a question if there's any. No? Let me see. There is, Julia, one person cheering you up actually on Instagram, I think. He's asking, hello, Julia, how are you? And how was your trip back home?
Yeah, I just I just came home last Saturday, so I just be home now 3 days. It's a little bit strange to come home, because it's like 5 weeks of intensive training, and you are only training and mapping and like training to get to become better, and then now I come home, and then you have to find a new way to keep everything in progress. So yeah, that's a little bit just searching how to do it, and it's just now my 3rd day at home, so it's really fresh at home, and but I still practicing every day, I get a schedule, and I can put the stimulator on and do my exercises. And I also have a walker at home, so I'm able to stand and to practicing also to keep walking at home.
Mm-hmm. Okay, very good. So it's actually, quite a new thing, especially for you. So I do hope, you get used to it. And please, as usual, if you need anything, any help remotely, that's what we do. We can stay, of
Yeah.
course, still communicate. Doctor, I don't see any questions. Would you like
There
to
is
add
one
something else?
question on my
There
screen.
is.
Yeah, I think it's from Kingsley. They are
Sure.
saying that they are C7 incomplete quadriplegic, and they have finger flexors and extensors which are coming back, but no, not like functional contractions. So they are asking whether they would need two stimulators, one for upper body, one for lower body. So C7 is actually on the border between being and not being a candidate. So if this is a I think the MRI scan would be helpful to answer this question, Kingsley. Um, I think from functionality point of view, I would say yes, maybe you would benefit from two stimulators, but we need to see if you actually qualify for two stimulators. Patients with lower cervical injuries, C7, T1 injuries, they are not a good candidate for cervical stimulation patients. So I think MRI scan would be very, very beneficial, and we can very confidently answer your question based on the MRI scan, whether you would qualify for two stimulators or not. Thank you.
All right. So, of course, Kingsley, we are very much happy to facilitate your medical evaluation. All right. So, feel free to reach out. We'll arrange your case folder, of course, for the medical team to review for you. And hopefully, one day you will speak directly to Dr. Nasir as well via consultation. Right. I think that's it for now. Doctor, would you like to maybe add something else or to?
No. Yeah, I think my message is what I earlier said and Julia mentioned. I think for my advice would be to everyone try to keep practice as much as possible. This is I think for individual spinal cord injury patients. So this is a tool they have. I think there are many things they can actually gain by just trying to stand in the standing frame every day and trying to practice as much as possible. So this is my advice to every injury patient. Spinal cord stimulation is an option, of course. Very hopefully there will be other options available, right? So if someone is in a better physical condition, of course, they would benefit more from any kind of treatment. So this is first advice. The second one is, of course, for anyone considering any treatment option. I think stem cell treatment is an option, epidural stimulation is an option, and in most of the cases we combine those two together, which is probably the best combination. So if anyone is considering, of course, feel free to send their medical information. We would, of course, give you very honest opinion about your prospect of recovery, and you can take it from there. Thank you.
Right. What about on your side, Julia? Any final message for the viewers?
Yeah, just maybe for the people who are watching with just recently gets injured, that they don't have to give up, and that they need to have trust, because it's maybe now a dark side, but it will become better. And just when you believe in yourself and your body, then you will recover. And don't give up.
Thank you very much, Julia and Dr. Nasir. For me, just to add, what I noticed is that, the happiest patient we have treated is the one who never give up, never stop, even after the treatment. They continue on, they carry on. So I think that's what I see for Julia, and of course, we are very excited to see a brighter future for you, Julia. Everybody, for those who attended, thank you again for joining and for asking questions. Ibi, Ronke, and Kingsley. And thank you, Julia, for sharing your journey, being an inspiration to many. And of course, Dr. Nasir, for your expertise. I'm confident that this webinar is helpful to everyone. For those who are still watching, I still see some 11 participants. And hopefully in the future, many people will, Julia, still be watching this. If everybody wants to have the recording, just feel free to reach out, send us your email in our private inbox. We'll send you the recording. And for those who are ready to do the medical evaluation, we are very happy to do for you. What else? I think that's it. Thank you again, and we'll see you again in the future webinars similar to this.
Thank you, Julia. Thank you, Bea. Thank you, everyone.
Okay, thank you, everyone.
Thank you,
Bye.
everybody.
Bye. Bye.